Welcome back, everyone, to our Virtual Cafe Summer Speaker Series. We're joined today by Jake Mills, chiropractor in Peru and a wonderful member of the Pole Physio team and one of our treating therapists in the Pole Physio team. So very excited to have Jake on board today. Thanks for joining us.
Hello, I'm very excited to be here. This is a topic that we are both incredibly passionate about. So strap yourselves in because it's going to be a wild ride and we're going to do everything in our power to not go overtime.
We've said that already once before in one of the other speaker series, and we'll see how we go. So today's topic is about what makes a good therapist. So this is going to be a bit of a joint discussion between you and me because we've both got experiences here. We both have probably our own views on different factors. So I guess before we get into today, I want to preface this that there may be some therapists watching, and for those therapists watching, if anything we say kind of strikes a chord with you, if there's anything that we sort of talk about evidence showing that it's not ideal to do certain treatments and you're continuing to do that, what we ask is that you don't take offense. We ask that you just have a moment. This isn't a personal attack at any point, but have a moment to let it sit with you, resonate, and actually then spend some time looking at that research and checking your own biases and see if there's things that you can do to work on making yourself, a better therapist, because we're all learning and growing, and stuff that Jake and I say today, in another 10 years time, there might be some more research about it that could change the situation. So we're purely basing what we talk about today based on current research as we know it. So little just there. So Jake, why this topic? Why is there a need for this discussion?
So basically it's because the whole physical therapy profession, not just physical therapy, rehabilitation of the musculoskeletal system, which includes people like physiotherapists, physical therapists, chiropractors, osteopaths, and in general, your general practitioner as well. We all deal with musculoskeletal issues on one degree or another. And it can be very confusing for the public how to address their musculoskeletal issues because there's a lot of different fields of thought, there's a lot of different opinions, and there's a lot of different ideas within physical therapy that contradict each other in a way that can be very frustrating when you're a person with pain, because when we have pain, we just want a solution. We don't want to watch two different professions argue with each other about what the solution is. We just want a solution. So when we're dealing with musculoskeletal stuff, it's so confusing. And to the general public, it's frustrating because at the same time, the world of musculoskeletal rehabilitation has become incredibly commercialized and very, very business oriented, which makes matters worse because when it's all about business, it's impossible to provide good therapy, near impossible to provide good therapy when the focus is on money making and commercialization. So what we've both seen a big trend within the world of rehabilitation, of commercialization. It's a product more than it is a service at the end of the day for a lot of these big businesses. And that can really mess people up. It can make pain worse. It can create a lot of bad beliefs, bad thought patterns. And we don't want that for you guys. We don't want that for the public. So our goal is to kind of educate you guys of what a good therapy program should look like so that you can know whether you're in the right place or not, and give you some of those red flags of what to look out for to more of a money-making commercial business, one of those.
You've already brought up so many good points that I want to touch on. So the first being, so you're a chiropractor.
I'm a chiropractor.
And
Controversial.
and I'm a physiotherapist.
And we're on the same page. So how is that possible?
Exactly. So that's probably the first point I want to bring up is that what you mentioned before is that we don't, as therapists, want to be pitting professions against each other. There are certainly some things, there's a lot of things as a physiotherapist that I'm trained in that Jake, you won't be trained in because that's what your schooling, takes you through and so forth. And it'll be the same with, osteopaths as well. For those who aren't aware, physiotherapists do a lot of training in the hospital system. So I spent a lot of time working through the cardiorespiratory unit, the neurological unit. So things like neurosurgery, as well as strokes, etc. So that's training that chiropractors and osteopaths definitely do not get. I did a lot of work in the emergency department, and you name it, basically physios end up doing it all. And we do also training in private practice. When people think about physiotherapists, they quite often think about the private practice physiotherapist or the sports physiotherapist. They don't usually think about the other areas of field. But we certainly have a diverse range of physios out there. So I think when it comes to the discussion about osteos, chiros, and physios, we're usually referring to the private practice physios, first of all. We're kind of excluding the rest of the physio profession from that debate. And I think there shouldn't be a debate. We're all there to try and achieve the same thing, which is patient outcomes, and we should be doing it in the best way possible, which is evidence-based care and patient-centered care. And it should be not about making money from the healthcare point of view. Yes, we obviously need to survive, and we should be making money for a living. We should be getting paid what we are worth as individuals. But when what your point before was when the focus shifts to the business-centered care, which is money-making focus and trying to get patients back and back and back unnecessarily, as opposed to patient-centered care, that's when we're in strife.
Well, let's break it down. Like, what are the good aspects of good therapy? The bare bones of a really good therapist are quality time with the patient, having deep and meaningful conversations, education, empowerment, and active therapy through rehabilitation, exercise, movement, and lifestyle coaching. So those things, all of them, are time and energy intensive, which means that on the part of the therapist, it's not an efficient process necessarily to go through all of that with the patient. We have to sacrifice time, we have to sacrifice energy, and in the time it takes for a really good quality therapist to see a patient, another lower quality therapist is going to go through 5 or 6 different patients in that same amount of time and provide a lower quality service that might not be as helpful. So the commercialization of therapy would be impossible to keep the same quality of service, if that makes sense. So it's like to become a big commercial or a big commercialized industry, you have to sacrifice one of those things that makes a good therapist: time, quality, and education. One of those things has to go. So if it's a big business, they're sacrificing something in the form of quality.
Yeah, absolutely. So at the Pole Physio, we spend with our patients that are new patients, we spend an hour with them. So as a bare minimum an hour.
Minimum of an hour.
Yes, I was going to say we try our best to stick to time with patients as well, but I definitely spend an hour with my new patients, and then my review patients are a minimum of 30 minutes. And my review patients, sometimes if they need that hour, I'll block off an hour for them as well. So it's really about spending quality time with them. So time is definitely one big part of that chunk. But there's no point as a therapist blocking off an hour with a patient if you can't provide a good service as well. So you spoke a little bit about active therapy, and you haven't really touched on yet passive therapy. So are you able to differentiate for the viewers what active versus passive therapy is, and I guess, what the difference is, and what you should be expecting from your practitioner versus any sort of flags that may arise with that?
Yeah, so in the world of rehabilitation, when you have pain or injuries, there's 2 different ways of approaching it. There's active therapy, and then there's passive therapy. A passive therapy is something that is done to you without your involvement. So think of a massage or a chiropractic adjustment. Those are things that are being done to your body, but you're not actively doing anything. You're not analyzing your habits, you're not changing your lifestyle, you're not exercising. It's something that's done to your body. An active therapy, on the other hand, is usually lifestyle coaching, exercises, or something that involves your participation actively. The reason we need to make that distinction is because passive therapies, research tells us pretty clearly that passive therapies don't tend to have a very good long-term effect. They might have a pretty significant short-term effect on pain and pain reduction, but in the long term, the solution lies in the active therapy, which means that if you're looking for a longer-term solution to your problems, pains, or rehabilitation, there has to be some sort of participation by the patient to make changes in the lifestyle, to start exercising, strengthening, conditioning, anything that involves that participation, depending on the type of injury or pain. But that is the only way that we know of to create long-term solutions. So it's an important thing for us to know, because when we see a therapist who prioritizes passive therapy over the active therapy, it's probably not going to create good long-term results. And unfortunately, there's huge clinics out there and a lot of physical therapists who pretty much only do things that are passive, things like a chiropractic adjustment, muscle work, the electricity, the ultrasound, all those things that are passive. They feel great sometimes, and there's some people think they have a great, like some people feel really good with them, and I don't want to diminish that. They have a great effect on pain in some instances, but in the long term, a good rehabilitation program always includes active therapy.
Yeah, there's so much I want to contribute to that. There's so many great points that you've already raised there. I think the first being when we talk about pain management. So a lot of people, their expectations. So a lot of the times therapists are limited by patients' expectations because they're a paying customer. So if a patient comes in with an expectation that you're going to put your hands on them, a lot of the times they turn around and they'll go, why aren't you putting your hands on me? They like have this expectation. It becomes really challenging for the therapist who's being paid to provide a service to then turn around and go, but this is what you actually need.
And I would argue it's much worse for chiropractors as well, because like people in their mind think that chiropractor is only someone who does a chiropractic adjustment, that manipulation. So if they come to me and that's all they want, they don't really want to have that conversation. So it makes it difficult when the conversation is going to be way more important than the chiropractic adjustment. So it's like, I totally get what you're saying. Like when people have that expectation, it makes it difficult. It does.
Yeah. So I guess from a patient point of view, what we would suggest is really be guided by your therapist to a certain extent, to be guided by what their experience is, because they've been doing this for a lot longer. Well, usually, no, that comes across wrong. You may have been experiencing pain for a long time, but they've been doing their job for a while. They've obviously been trained in it. And so if something's not working from a passive point of view, it's usually because you're not putting in an active component as well. So I guess that's what I say to the patients out there who go in with expectations of hands-on treatment. Whilst it might be nice to have that short-term relief, a lot of the time you can actually get short-term pain relief by doing an active modality. So a lot of the times, and that's patients need to try to shift their thought process a little bit here. I'm being a bit mean, but if you can shift it to thinking that passive treatment is the only thing that can provide you with pain relief, to active treatment can also provide you with pain relief. I think that's very helpful. But also the therapists need to shift some things here as well. With risk of being a little bit controversial, I think that some therapists need to look at their own biases and think about whether they're bending to the patient's expectations or whether they're actually truly providing great quality healthcare service per evidence-based guidelines. And sometimes with certain situations, that may mean not touching the patient at all that day and actually providing purely active style treatment, whether that's education or exercise or so forth, depending on their condition. So what has always irked me is seeing therapists who have a half an hour appointment spend 25 minutes with the patient providing hands-on treatment, and they spend the last few minutes trying to cram in an exercise, and they'll maybe get one exercise into if they're lucky, and then rebook the patient. So that's 5 minutes that they've spent trying to cram in an exercise, where happy for you to spend some hands-on time, maybe 5-10 minutes trying to actually get some temporary pain relief. You don't really usually need the full 25 on that. Get some temporary pain relief to utilize it to then help facilitate the active style treatment modality, because you're spending half an hour with a patient that is literally half an hour in their 1 week or 2 weeks, how often you're seeing that person. That is going to make a short-term change for a day at the most. If you're lucky, a day, 2 hours really. So try to give your patients something that they can actually get pain relief from every time they do it. If someone
think in the long term, like what's the best use of your time? Providing a little bit of pain relief for the moment, or actually helping this person with their entire life?
Absolutely. So I think if we're trying to settle down pain in the short term, providing the patient with something that they can utilize at home will mean that they're going to get short-term pain relief more frequently, more often over that period of time, to then hopefully get long-term pain relief through more active approaches. So particularly
I think it also
you're right.
Well, I think it really boils down to this idea, and this is gonna burst a lot of bubbles, and I'm so sorry, but there isn't a magic bullet, and there's nothing that's gonna like magically and quickly and easily heal you. And I think a lot of people have that expectation when it comes to passive therapies. They're like, oh yeah, we're going to do this one special treatment and it's going to fix all my problems. I get that a lot as a chiropractor. People go to a chiropractor expecting that the adjustment's just going to poof away the problems, but that doesn't exist. And if it did exist, we would have discovered it by now, you know? So it's like, when it comes to actual rehabilitation, we need to stop having that expectation in our minds that it's going to be easy, quick, and without any effort. Right. And I think a lot of therapists want to be idealistic. Like, in our hearts, we, as a chiropractor, in my heart, I would love to tell somebody that I could heal them with an adjustment, like in one easy, quick, passive therapy session. But it's, and people like hearing that. So I get the kind of the pull to believing in that kind of that worldview, but it's just not realistic. And it creates these bad thought patterns, and it's misleading in the long run to over rely on those passive therapies.
So can we do some quick myth busting with you as a chiropractor, and obviously with myself?
Let's do it. Let's talk about it.
Someone's ribs gone out.
How many times have people's ribs gone out? What?
No. Someone comes to you and they've been told that their ribs gone out. What do you say to that?
I say that that's not really something that can happen. Like, your ribs are very well secured to your thoracic vertebrae, and it would be an incredibly traumatic event to cause it to go out, so much that it probably wouldn't be your primary concern. Like, the rib going out would be last on your list if you're in such a traumatic event to cause that. You might have a sensation or a pain that someone has told you is a rib going out, so the sensation and the pain is completely valid. Like, what you feel is real, but the narrative around it is wrong. Like, the rib isn't actually out, and it doesn't need to be put back into place. There's something irritated for a very valid reason, but it's not something as simple as like, it's out, you got to put it back in. Like, that's a very reductive or a reductive view of the issue.
Same things get said so much about the pelvis. My pelvis is like, my, so-and-so has told me that my pelvis is slipped up or slipped down or out or whatnot. Exact same thing. The pelvis is physically the most stable structure in our body. It takes considerable amount of trauma for it to become unstable. So not saying that it can't happen, but I mean, when I say considerable, I'm talking like a truck.
Yeah, you would have to be in like a very bad car accident to where like you wouldn't even care about your pelvis at that point. You'd be more worried about the internal bleeding and the other stuff. So it's like, that would not be the concern. And if you did have a pelvis out, you probably wouldn't be at a chiropractor, you'd be in the emergency room, right?
Exactly. In terms of a rib, again, the same thing. So a rib can technically displace, but it takes considerable amount of trauma or instability secondary to connective tissue disorders. It is not a common thing. So Jake and I cringe when we hear these terms that my rib's out, or, it feels like this is out and so forth, because it takes a real special condition for that to actually happen. And so the average population saying my rib's out, or my back's out, or something like that, it's colloquial terms. We get what you're trying to say. But physically, if you actually believe that your rib is sitting out, it's the narrative can be quite damaging. So it takes a fair bit for any instability, and it's all about this narrative. So that's what a bad therapist really looks like, is someone who creates this insecure narrative, this sense of vulnerability within the patient. So they create this dependency on the patient to then have to see them to physically put things back in again, which simply is not the case.
Honestly, the best way to identify, like, if a therapist makes you feel broken and then tells you that they have the solution, it's probably a bad therapist. Like, it's that simple. They make you feel broken by using terminology that degrades your body. They tell you you have degeneration. They tell you you have your ribs out, your spine is misaligned, your hips are out. Like, they'll tell you these words. I guess degeneration means a lot of things. We won't add that in there. They'll tell you that things are out of place or out of whack. You slipped a disc. Like, those things are meant to scare you and then convince you that the only solution is the therapy that they have to offer, right? So that's a scheme. Like, it's a sales tactic. It's depreciating language to make you feel bad about yourself and feel like it's outside of your control. And that's the worst part, is the narrative. The reason it's bad is because when you believe that narrative, you also believe that there's nothing that you can do about it. And that's never true. Like, when it comes to those types of issues, there's almost always something that you could do about it actively.
And that's the key there, right? It's they're basically selling you something that only they can fix, versus a good therapist will technically be selling you something because you're purchasing a service from them. Hopefully they're not doing much upselling and making them seem like a salesperson, because that's not what it should be about, but they're technically selling you a service. But the idea is that a good therapist should be empowering you to take care of yourself and basically giving you the answers so that you can have the solution, as opposed to them healing your injury. I think that's a part of it. And then in a part of that package, yeah, there may be some hands-on treatment that helps you temporarily to assist, but yeah, there's so much a part of it.
But yeah, the passive therapy has a time and a place. So we don't want to talk down on passive therapy, because there are great and very valuable uses to it. And I'm sure many of you watching this have seen good results from passive therapy in your own life in the short term. So like if someone has an acute injury and the pain is unbearable, a passive therapy is a wonderful way to help reduce that pain to a manageable level. But it's not the long-term solution. It's the short-term solution. So that's kind of the narrative things. Like, we don't want to say that passive therapy is bad, because it's not. We just have to know that there's a time and a place for it. But when a therapist is using a passive therapy as their sole means of treatment, then we have a problem.
I also want to shift a little bit of the narrative as well, is that when people are in acute amount of pain, is that they always just go straight to the passive therapy as well. So I would love for people out there to also start thinking about, instead of going to get a massage or get hands-on straight away, what can I actually do to help myself? So what active strategies can you use to help yourself? Or can I see someone and they can provide me with active strategies? So not always relying on them for those passive treatments as well is helpful.
To come in a pair, right? Like pair it up with something active. It's like I sometimes tell patients, like patients ask me like, hey, should I take like an anti-inflammatory when I have a neck pain or something? Like, yes, go for it if that's something you feel like you need to do, but pair it with something that's active. So take the medication and then think to yourself, what can I do in my environment to help better my health or make some improvements to my mobility? Like do something also to make more of an active long-term change. So pair it so it's not just a reliance on passive therapy.
Yeah. So there was a point that you raised earlier before that I want to come back to, which is about I guess, and I'm trying to not name certain professions here. I'm happy for you to, but there are definitely certain professions that are more known to do contract style treatments, which is when a patient...
chiropractors.
Oh, so, and look, again, Jake's a chiropractor. I'm friends with Jake. Jake and I have a very good aligned treatment, system in terms of our beliefs and so forth, and it's evidence-based. So it's not all chiropractors, please. It's not all osteos. It's not all physios. Physios are not perfect. So I'm not trying to make it seem like physios are better than any other profession either. But certainly chiropractors more than most. I've seen in the past, and potentially certain countries as well, more so, because I'm an international healthcare practitioner. I've seen so much that happens in different countries that's really different to my own country, which is where I've spent a fair bit of working, which is Australia, for those who are watching. So I've seen patients turn up to this, they're professional, and they have, there's so many points I want to raise here. They've seen them. There's been some fear mongering potentially that's happening, and that person has usually sent for imaging, which we'll talk about in a second. But what happens is because that's an issue in itself. They've sent for imaging. They've then utilized that imaging to do some fear mongering. They've turned around to that patient and said, "You need to see me every week for the rest of your life, or you need to see
3 times a week." 3-4 times a week, twice a day. Like they come up with these crazy things and they project it out for months or years, right? So yeah, that's what she's talking about, like these based off the initial consultation that they have with, it could be a physical therapist or a chiropractor, anybody. Like if you go to an initial consultation and then after that they recommend this treatment plan that spans an incredibly large amount of time, hands down 100% of the time it is always wrong and unreasonable and borderline unethical.
I'm gonna there's always little asterisks to things, and like this. And that's okay, that's fine. One of the asterisks I'm thinking about is like an ACL injury. So if you're returning from an ACL rupture, it's probably going to take 12 months. So there's going to be certain injuries out there where, yeah, you're going to spend a fair bit of time with your physio. And I'm obviously not talking about neurological conditions or anything of a medical nature.
Right. Yeah.
That's going to be long-term rehab and so forth. And for some patients who, disabled patients, or they're associated with a disability. So I think for those, there might be ongoing life rehab or ongoing physiotherapy. So we're talking about a certain population here who have maybe acquired an acute injury or subacute injury, or maybe even a chronic injury. If someone is trying to say to you that you are needing to have treatment and lock you in on day one and book you in for 6 months worth of treatment on day one, that should be a bit of a flag there, unless you have acquired quite a significant pathology. You've got a really
so I think there is a difference between like scheduling therapy and then planning out the time of rehabilitation. So I think the best therapists are one who give a very realistic range of healing. Like if it's an ACL tear, they'll be like, this could take about 12 months of healing. But there should be no need to contractually like sign you up for 12 months of treatment in advance, right? Like to get you to pay a huge amount of money for a huge quantity of sessions, when it really should be at least month by month or 2 months by 2 months. There should be like a time period where let's do this month and see where we're at, and then gauge the next time period. That's more reasonable, and it follows a little bit more the guidelines than planning 100% of the treatment plan. I think even in an ACL tear, usually therapists won't plan out all 12 months based off of the first consultation. No. I don't think that would be unreasonable as well.
That's unreasonable. So if I saw someone for an ACL injury in terms of rehab, I would book them in for maybe 3 or 4 sessions in advance. And I'll just be like, right, based on what you're showing me today, this is what's happening. This is where we're going to go for this period. I can probably foresee that you will need these appointments. And I know I get booked out quite easy. So that's the only reason why I'd be booking those sessions in, because I know that they need those. And then I'd be like, right, from here, this is where things will end up. And we will approximately see each other this many times in this period. But this is going to take, in the foreseeable future, 12 months, 15 months, depends on their age and a whole bunch of different things, whether they have surgery or not. So it just depends on the individual as to how much you'll need to be seen. But that's what a good therapist will do, is it.
And it should also be dynamic and changing. So I think that's the other thing.
And I've done that before, where I've booked appointments with patients and I'm going, you know what, I actually don't think you need this one. So let's push that one out to like a month in advance, because you're doing so much better than I initially expected. Let's move that. You don't need that. So it should be like here's our plan. Plans can change. Shit happens. Sometimes I've planned for a month down the track, and then an injury, a new injury's popped up, or they've flared something up, and I'm like, right, let's bring that one back in, or let's leave that there and let's pop another couple in between. Things change and move. But I truly, as a junior physio, when now I'm not a junior physio, but back in the day, I never actually thought that contracts happened in Australia. Maybe I clearly was very naive. They happen. And so I was privy to a patient who came and saw me for a second opinion, and it blew my mind. So to the point that I've kind of followed this up and made sure that it wouldn't happen again. But I had a doctor in my area refer a patient who was in a car accident to a professional out in the eastern suburbs at that time. So it was about a 2-hour drive for this individual to go and see this healthcare professional. And they were basically, like Jack and I, just like a primary healthcare practitioner. And so they saw this patient, and basically the patient turned up with no pain, full range of motion. They didn't look at their strength at the time based on what the patient told me, and I went on to look at their strength, and their strength was probably 95% of what was normal, so it was really close to really good. But that particular therapist took imaging, which, like I said, we're going to talk about in a second, took imaging, basically fingermongered the hell out of that patient, said that they would end up pretty much paraplegic, even though there was nothing on the imaging to show that was going to happen at any point whatsoever. Again, we're going to talk about this in a lot more depth, because I know we've got heaps to chat about imaging wise. But fearmongered the hell out of them, presented them effectively with a contract that was like, you will see me every week for the next 6 months, and then after that you will see me fortnightly, and you'll be seeing me fortnightly for the rest of your life. Here, sign your life away. So the patient took this contract to me with all of the information that professional gave them, and it was a handout, like handout after handout after handout. And I was looking at this, and even back then we had limited research. I feel really old now as I'm saying this, like 10 plus years ago. We had research about fear mongering. It was nowhere near as bad, like as much research as what it is today. But even back then, I was like, this ain't right. This is not right. And so followed this up further. I basically then went on to assess the patient. Everything was completely normal except for mildly reduced strength in their neck, which I gave them an exercise, and I was like, you should never see me again, but if you're finding these pain returns, there's any discomfort, you notice changes in your movement, come back and see me, but you shouldn't need to see me again.
So basically they were just fine.
We're completely fine. They were absolutely fine, and this person was trying to sell them. We'll lock them in for 6 months as a bare minimum, and then from there it was like, you'll need to see me for the rest of your life. And
yeah, and I guarantee that it's the exact same recommendation they give to all their patients, no matter what condition they have. And that's the problem with the commercialization of therapy, is that it makes it really easy for the doctor or therapist, because they give the same recommendation to everybody, with the hopes that it might help them a little bit. Like this will probably help them because it's passive therapy. Like passive therapy still feels good to some people, so that'll make people feel better. So it's like it's super lazy. And I guarantee also that specialist probably was only doing passive therapies. There's nothing active in that therapy process.
Yeah, so can confirm that. So basically ask the patient as to what happened in the initial session and what that person basically had outlaid for the next 6 months. I was like, what are they going to be doing in weekly sessions? And basically went into detail as to what they thought the patient required, and zero active treatment in that. Because I went, maybe they could see you once more, twice at absolute stress to just make sure, absolute stretch to make sure that your strength has improved to the required amount. But they didn't even assess for strength. It was purely passive style treatment, which is not necessary. I'm so grateful that that patient clued on fairly quickly. And I mean, that was a very obvious case, but sometimes it's not that obvious. But that patient clued on so quickly, and then obviously sought a second opinion, which they shouldn't have to do, first of all, but that patient paid out of her own pocket a very small amount of money compared to what she would have otherwise paid. But like, it shouldn't happen in the first place. So
do you want to talk about the cost real quick? You said a very small amount of money. So let's talk about that cost thing. So the good versus a bad therapist. Good therapists invest a lot of time in the initial consultation. So for Simone and myself, we spend more time and energy on that initial consultation than anything else. It takes a lot of time, a lot of energy to really get to know somebody and get to know their problem or their goals. And because of that, we cannot do it for very cheap, because it's the most valuable thing that we do. Whereas a patient mill, as we call them, where it's like just a business that just churns patients in and out, tries to get everyone to come as many times as possible, they use the initial consultation as a way to get people in the door. So it's always discounted, it's always very cheap, it always includes x-rays, it always includes all this stuff. It tries to be a very appealing offer to get as many people in the door as possible. So that's actually the first red flag. If there's a clinic that's doing a really cheap initial consultation, it's almost a guarantee that they're going to do a very bad job, because the initial consultation should be the most expensive part. It should be the most difficult part for the therapist as well. And it should take a significant amount of time. So most of those clinics, they do like a $29 initial consultation, and it takes 10 minutes with the specialist. And like, there's nothing you can do in 10 minutes that would cause any long-term effects. So that's kind of a red flag to look out for, is actually the price. Like a cheap and the thing is, like, that initial consult is cheap, but how many thousands of dollars are they going to try to sell you in continued therapy? From that point on, they're going to try and fearmonger you and get you to sign up for way more money. So it actually is the opposite, where the good therapist costs you way less in the long run, because you're going to get better faster, you're going to have more long-term results, and you're going to need fewer sessions. So it's like the cheaper therapist costs way more in the long run.
And I was going to say, my patients, I know, would attest to that. They don't actually see me that much. Initially, in an acute injury phase, they might see me a couple of times, but when we're in a subacute phase, they spread out. And I have patients that see me 6 to 8 weeks. So, that's the strength and conditioning stuff, and that might not even be for an injury. I have patients who don't need to see me after a certain time, where I'm just like, cool, you saw me 3 times, that's perfect. Good job, off you go. And so it really depends on the person. And if someone's trying to be like, no, you need to see me a minimum of this many times, just be really mindful that if they're an employee of a business, they might actually have KPIs. And I'd like to think
they're being forced to tell it. I've worked in a clinic where I had no control over what I told the patients. The patients would walk in the door, and the clinic manager would tell me, like, you need to recommend 36 patients to this or you need to recommend 36 sessions of treatment to this patient to meet our daily minimum. Like, that's illegal. Like that's messed up. But that's how these clinics run. And nobody's gonna say that up front. Like but I almost can guarantee you is that if they're offering that cheap initial consultation and they're recommending big treatment plans, it has nothing to do with your condition. It's just they're trying to meet their bottom dollar and make money.
36.
36 was the minute. The clinic that I started off working in right after I graduated, the minimum amount of treatments that I was allowed to recommend was 36 treatment sessions over the course of 3 months. So it was 3 times a week for 3 months.
Whoa, sorry, my face just another.
I know, it's crazy. And I'd like to say that that was rare, but that was kind of the normal for the part of the world that I'm living in because there's not much government regulation. So like my mission in my part of the world is to try and get that changed because it's super unethical.
Oh, it's incredibly unethical. That's malpractice. that's unethical. That's unethical. I mean, it probably
That's a whole nother video.
I was gonna say probably not. I would argue it's malpractice. I don't think it would get past as malpractice, but in Australia, that would be borderline malpractice.
But I can guarantee you it's also happening in Australia. So I know this business model, it happens everywhere. It's like a very common business model for, I don't want to say just chiropractors, but chiropractors.
Well, also, unfortunately, like in Australia, certainly more so than osteos and physios, but I know that business model happens with physios and osteos as well. So I've certainly been in business before where actually we had different KPIs depending on your therapist level. So senior therapists were required to see a patient more than junior therapists. They expected the junior therapist wouldn't see them as much, but they still had minimum requirements. So I think the junior therapist was like a minimum of 6 times, and the senior therapist, it was like 8 to 12 times. So that was one clinic I worked at. Another clinic I worked at was like a minimum of 8 times. So if for whatever reason in the physio world, it's like a good therapist should see their patient 8 times. And
which, like, how crazy is that? Like, just thinking about that, like from an outsider's perspective, is like when you go to a doctor, when you go to any healthcare provider, that healthcare provider shouldn't be thinking ahead of time, I'm going to see this person this amount of times.
yeah,
like it has nothing to do with what you need as a patient, nothing to do with you. It's literally just trying to meet the needs of the clinic, and it's so common.
yeah, that's business-centered healthcare, which is not appropriate. Yeah. We are trying to provide patient-centered healthcare. And so if that person needs to be seen 8 times, fine. That person needs to be seen 16 times, fine. But that person might only need to be seen 2 times. And so my bosses absolutely despise me for, maybe not despise me, but they really weren't happy with me when I never provided KPI or business-centered healthcare. I would never do that. And I've never done that and never will do that. And so we don't have KPIs at the Pole Physio. I don't believe in that bullshit, excuse my language, but I don't believe that should happen from a business point of view.
Yeah, like I work with Simone in seeing patient care. We have never once discussed the number of visits that we see with patients. Like that's just not something that comes up because it's completely irrelevant. It's like, are they getting better? Are they getting the information they need? Are they getting the empowerment they need? Like that's honestly the only thing that matters. Sometimes it takes more sessions with some patients, sometimes it takes fewer sessions, individual basis.
Exactly. And if I was, and I haven't, because I don't care. Maybe I'm a terrible businesswoman from this point of view. Who, like, there'll probably be business owners out there being like, well, you're screwing over your own business. Fine. But if I actually then took the time to sit down and calculated my average patient visits based on what I see, it probably works out around whatever that number is. But do I care? Is that in my mind when I go to book patients? Absolutely not. It is so not.
It just takes more energy. It takes more energy and effort. Like I'm also convinced like the income evens out. Like patients spend less and the therapist still earns about the same, but it takes so much more energy investment on the side of the therapist to take the time with the patients. I just don't think all therapists really want to do that. It's just not appealing, I guess, to everybody. So
yeah. I'll see a patient, like I said, there'll be a patient who comes to me and they want ongoing strength and conditioning because they want to try and smash their nemesis goals, and they might not have an injury, and that's it's a product I provide, it's a service I provide, is to actually be able to condition you and nail your nemesis trick because you're not getting it for X, Y, and Z reason. And that might take 3 to 6 months depending on where you need, and that might mean we have 4 or 5 sessions within that time frame, and then you're so happy with how well you do there, you might turn around and go, okay, I've ticked that goal, I've got 3 other goals I want to work on. So I end up seeing those people by their choice. At no point am I saying you need to see me because, you know, and this time frame or whatnot. They're choosing to see me because they know what they're getting from me. It's a service that I offer that they're really happy with, and so it ends up equaling out. But then I have patients who, and we're chatting about a few of our patients earlier this morning, we were saying, okay, this person might only need 2 sessions, or they might only need 3 sessions, and that's completely fine with us. We do not have a requirement of sessions for patients, because I just think that's just blows my mind that people do that.
Because like we can do so much in one session. Like I feel like most all of my patients, if they do need second or third sessions or more sessions, that's irrelevant, because by that first session, it should at least be pretty well under control, like when they're understanding and at least a plan to move forward. So like the first session in and of itself should be pretty cut and dry. So it's like, okay, we've determined what's going on. We have some ideas. Now we have a plan and we're going to start initiating it. So like that first session honestly is enough for a huge amount of people. And then it's up to them whether they want to progress with it correctly and under supervision, or if they think they can handle it on their own. Like we can't control that, and we don't really try to. Like we give our recommendations, what we think is honest, but if people feel like they can handle it on our own after the first session, I feel good about that too. It's like if someone can't afford to do more than 1 session, at least I feel proud that in that 1 session, it was as good as it's going to get when it comes to therapy.
Spot on. No therapy should be a lock-in contract. There's nothing like that. Our job is to make our patients happy and to help them achieve what they want to achieve. And whether that's being pain-free, you know, symptom-free in general, improve their mobility, improve their strength, smash, you know, their goals, their movements, their functional ability, like whatever it is, that's our job. We're here to help you with that. And so our job is to help you on that journey, however much you need us. So unfortunately, we didn't stick to our promise, and Jake and I spoke for quite a while on this topic. And so I've gone and edited this this chat into 2 parts. So you've just listened to part 1 of the chat. We'll be releasing part 2 next week. So don't worry, you'll get the full story soon. I hope you've enjoyed what you've listened to so far. But we are going to wrap it up today to just keep it a little bit more bite-sized. And then Jake and I will be joining you shortly for part 2. If, however, in the meantime, you found all that information really super interesting and you want to touch base with either Jake or myself, we're available for online bookings at our website, www.thepolephysio.com/book/online, or you can just go to thepolephysio.com and follow the prompts from there. That might be a bit easier. And as you've seen probably from our chat today, Jake and I work in what we think is the idealistic way. Maybe we're a bit biased, definitely a bit biased, but what we'd like to think is the most supportive way for our patients to help them back from a rehab point of view. So if you need a second opinion, or if you need injury advice, or if you need help with your strength and conditioning for pole, we're here to help you. So certainly jump online and check out our link and book an online appointment. We'd love to see you.
We'll see you soon, and we'll see you next week in part 2.
Yeah, see you in part 2.